see. Good morning, everybody. Hi. Yes, chorioamnionitis is a risk factor for early and late onset sepsis in preterm infants. Yes, this is a systematic review and meta-analysis. Yes, this is a meta-analysis we did. Yeah, a short introduction. Yeah, chorioamnionitis, multi-organ disease of the fetus, is implicated as a risk factor for several other diseases. Among others, a lower rate of respiratory distress syndrome, but a higher risk of BPD, neck, transient hypertoxemia of prematurity, etc. So the other question that arose for us was, is chorioamnionitis a risk factor for neonatal sepsis in preterm infants? Yeah, some short definitions for a meta-analysis. We defined early onset sepsis as when the children are born, over here, when they develop neonatal sepsis within 72 hours, and late onset sepsis after 72 hours. For chorioamnionitis, we distinguish between the clinical definitions based on clinical symptoms, histological and on placental pathology, and there were a few studies that we found which used microbiological definitions using placental villi samples. And for sepsis, we distinguish between clinical and culture proven sepsis. That's important later on for the results that I have. And we included preterms with a gestational age below 20 to 32 weeks and very low birth weight. In total, we had like 113 studies we included. Now, for the first results over here, we have culture proven early onset sepsis. What we see is these are the chorioamnionitis types. Overall, we see a significant association, strong association, and over here we split out with histological, clinical, and microbiological. As you can see, we've had more histological studies and a lot more also many clinical studies. There's a strong association here with the culture-proven early onset sepsis, and similarly we see a strong association between clinical early onset sepsis and CA chorioamnionitis overall. So far, so good. Now, as for late onset sepsis, it was also interesting. We see with culture-proven late onset sepsis that overall there is also a significant association, but it's more moderate. Also, again, histological, clinical, microbiological were also all subcategories were significantly associated. Now, as for clinical late onset sepsis, that's the thing with meta-analysis. We didn't have that many studies or any studies that also used a definition of clinical late onset sepsis and had data on histological CA. So that's why you only see clinical CA listed here, and that's where we see no association. Now, as for the next introduction here. Studying chorioamnionitis as such in preterms is difficult, because in order to study preterms you don't have a healthy control group. The distinction that we made here, which you can make here, is like you have preterms, they are preterm born early because of inflammation, such as chorioamnionitis, leading to premature parturition or dysfunctional placentation. Where you try to manage a pregnancy until it becomes too dangerous for the mother, and that you have to induce birth. So they're born, usually you would expect that the children preterms born due to dysfunctional placentation are born a bit later, a bit older, while the ones who are born to do preterm labor, placental abruption, or chorioamnionitis are born younger. So this means that basically we're comparing the preterms with chorioamnionitis with the control, which have underlying dysfunctional placentation, which is important for this particular slide. What we see is that the children with chorioamnionitis are born like around more than a week earlier and around 50 grams lighter. The interesting thing is that despite that, they're not small for gestational age. So they're a bit lighter, but they're not small for gestational age. The other interesting finding was that we do see that the children with CA get more antenatal corticosteroids. Yeah, which is also interesting because CA, unless it presents with clinical signs, is usually clinically silent. So a lot of these, or at least that's also what we assume, is with many of the studies that use the histological definition of CA, a lot of obstetricians gave these children antenatal corticosteroids without knowing that there was underlying chorioamnionitis. That's interesting for later. The other results that we see here are, as to be expected. Okay, they have compared to the group with dysfunctional placentation, they have a higher risk of premature rupture of membranes, a lower risk of having a C-section, a lower risk of preeclampsia, but they have a higher rate of mortality because it's assumed that with chorioamnionitis there's underlying infection, so they're sicker and they're more likely, that they're sicker and that they're more likely to die because of that. Yes. So the other thing is that we had like varying ranges of like a confounding factor is the gestational age. They're all born premature, but you're comparing different studies, different ages. So we had to look at how does gestational age, difference in gestational age, influence the odds ratio that we find. Now this slide in particular, will take you through it. This is for early onset sepsis. So this is on the log scale. On the vertical axis is the odds ratio for chorioamnionitis and early onset sepsis. Here's the nil. So this is basically an odds ratio of 1. And over here on the horizontal axis we have the age difference. So here is the nil. And as you go back, like the age difference becomes larger and larger and larger. And the other thing is, this is just looking at the chorioamnionitis group, so minus the control. Now, we see here it's like the horizontal line with the odds ratio, which is pretty much horizontal. And if you have the age difference here, it's nil, 1, 2, 3, 4. If the gestational age were to have an effect on this odds ratio, that it would be a confounder, you would expect to have a slope, but you don't. It's horizontal. So what we can take from this is that gestational age, that the effect CA has as a risk factor for early onset sepsis, independent of gestational age. Now, with the second slide, this is interesting. This is for the late onset sepsis. This is where you see something different. Again, here if you have the difference in age, here if you have the odds ratios. You see where's the mouse? You see a slope here. So what you see is like the younger they are, that the odds ratio associated increases, and this variance is up to like around 50%. So what we can take from this is that chorioamnionitis, the effect, the association that we see is in part dependent on gestational age. So, in conclusion, this is for the first two slides, we observed a strong positive association between chorioamnionitis and early onset neonatal sepsis, and a moderate but still significant association between chorioamnionitis and late onset sepsis. Now, the interesting part is with the meta-regression, our meta-analysis confirmed that preterm infants exposed to chorioamnionitis are younger and sicker than preterm infants non-exposed to chorioamnionitis. Well, this fact appears to confound the association between chorioamnionitis and nosocomial late onset sepsis, since chorioamnionitis exposed preterm infants would require longer hospitalization, more days in phases therapies. In other or simple words, the most likely theory you could generate from this meta-analysis is, okay, children born to CA are born younger, they have a longer hospitalization, so they spend more days in the NICU where they can get sick postnatally. Alternatively, what you could also consider is that chorioamnionitis may also alter the developmental trajectory of the fetal and neonatal immune system, and therefore may indirectly modulate the risk of late onset sepsis with nosocomial organisms. So that basically that the chorioamnionitis changes how the immune system develops with these preterms, and there's a kickback that you see, like, okay, that sets it up, that they're more likely to run into infection, late onset sepsis infection. Then coming back to the antenatal steroids, that's the other thing. That may also be a confounder in that sense, because if they get more corticosteroids, which is also an immunomodulator, that might also play a role in this. And that's where you run into the limits of a meta-analysis, like several different hypotheses you can generate from this. But what's what, that would require different separate research. But it gives you association. We see the associations, and well, it's very interesting to see that the late onset sepsis, especially with also seems to be linked to the chorioamnionitis as such, which was something which we previously would not have directly assumed. Yes, that would be